Yes, ma'am.
Yes,
It's visible, ma'am.
Yes, sir.
It is visible.
Yes, sir.
Continue. Okay. This every counseling center will have counselors in addition to the director of the center. These counselors conduct lectures, workshops, and seminars throughout the academic year on the broader topics like stress management, alcoholism and drug abuse, basic mental health problems, and life skills. These are the topics every student is exposed to. We go to every classroom and conduct this type of programs. The student service centers maintain separate records of students appearing to be more vulnerable and stressful for further support. Some are very innocent, ignorant. We give importance to them, we provide services to them. Confidentiality is maintained for the services and the information. Broadly, these centers provide for services concerned with one, normative stressor, non-normative stressors, adjustment difficulties, and life transitions. I will explain each one in detail. Normative stressor. I said earlier, stressor means the cause of the stress is called stressor. Death of an individual is stressor. Stress is the outcome of that.
नहीं,
So
सुबह
stress,
में 10 से 11:30 तक, 11:15 तक.
stress is the reaction to the stressor. We have two types of stressors. One, normative stressor. Normative stressor means the stressor which is predictable and expected. These stressors are predictable and expected. What are those? Academic problems, relationship problems with other friends, family related issues, including poverty, substance abuse, attendance problem, dropouts. These are all the important normative stressors. I repeat again, stressor means the event. The event is academic problem. So how do you react to that? Some problems are academic in nature, some are relationship problems, some are family related issues, some are substance abuse, attendance problem, and dropout. You have to deal with these normative stressors. I repeat again, normative means this is expected. Non-normative means which is not expected. Unexpected life events which are not typical across life cycle. That includes serious illness, death of a family member, or accident, or a crisis at home. When they say crisis means a disturbance at home. Crisis means some upset of steady state of mind is called as crisis. Something has happened which is which is not bearable. A crisis is an unexpected, unanticipated problem which is very difficult to manage, which is difficult to overcome. This is what we say crisis. Okay. So non-normative stressors. The third one is adjustment difficulties. Unable to adjust with others, unable to adjust with the system of the college or the university. The fourth one is life transitions, which include what to do after completion of the course, what next, starting a new job, moving away from friends, role ambiguity. These are all the problems that come under life transitions. So we provide counseling services on these 4 issues. Concentrate more on that. Please understand that counseling services do not pay attention only to the problems. We pay attention to the prevention of the problems, We also pay equal attention to the development of the students. So we work at 3 levels. One is developmental level, second is preventive level, and third is therapeutic level. Okay. At these 3 levels, we work in the centers. Next is what are the factors that constitute good counseling? Counseling is not a highly technical subject. We all can be good counselors. You can be a good counselor. The facts are one, good counseling does not take a lot of time, especially if the approach is tailored to the client's needs. Good counseling does not consume more time. Don't be under the impression good counseling means it takes more time. No, good counseling does not mean taking a lot of time, especially if you know, if your approach is adopted to the client's requirements, it becomes very easy and it will not take much time. Second, good counseling makes clients satisfied. Not only the clients, but also family members also will be happy. Training is required for providing good counseling. We have training, short-term training and long-term training also we have. We have 2 days training for teachers on counseling. We have 1 week program. We have 10-day program. We have a refresher course or orientation program like this. Good counseling is flexible. There is no rigid procedure to be followed. There is no format to be followed. Good counseling is flexible. Not all clients require the same process. Some innocent people require a long-term process. Some are well-informed and some are ignorant of many things. So don't be under the impression that we follow the same process for all the cases. Now, what are the things we expect? The personal changes to be achieved through personal counseling are deeper self-knowledge. That means ability to understand one's own emotions, behavior patterns, strengths and weaknesses. So through personal counseling, you can bring some change in the person. What change? You can make him understand his own strengths and his own assets and liabilities also. A change of attitude, modification of beliefs, feelings towards a specific object, person, issue, or event. A modification of self-perception, how a person views himself, how a person understands himself. That's what we say internal lens. That's what we say self-image. A modification of the perception of others. Your understanding of others can be modified, and others' view and interaction with you also can be modified. These are all expected positive changes which we can achieve through the counseling. I repeat again, deeper self-knowledge, self-awareness, a change in the attitude from negative to positive, a modification of self-perception, and the last one is a modification of perception of others. Counseling and psychotherapy, both are not one and the same. But some others say that counseling and psychotherapy are one and the same. The difference between counseling and psychotherapy is a controversial point even today. Most psychologists today would agree to a difference of degree rather than in kind. Some psychologists are under the impression that counseling deals with the day-to-day problems, whereas psychotherapy deals with the deep-rooted problems. It is psychotherapy. Therapy means treatment. Hence, we say psychotherapy is a deep-rooted treatment technique, whereas counseling is superficial. That's the reason we have different types of counseling. We have marriage counseling, we have family counseling, we have HIV counseling, we have employee counseling, we have different types of counseling. So counseling deals with the day-to-day problems, whereas psychotherapy deals with the deep-rooted problems. The goal of psychotherapy is to bring about desired behavioral change in neurotic patients, alcoholics, drug dependents. Whereas this requires many sessions and it may last for months and sometimes years also. So psychotherapy is more intensive in nature. Can we practice psychotherapy? Means no. Because psychotherapy requires a prolonged training. And those who have qualification, as I said, in Mental Health Care Act, the psychiatrist, clinical psychologist, and psychiatric social worker can practice psychotherapy, whereas we can practice counseling. So in terms of intensity, psychotherapy is more intensive, whereas counseling is superficial. So personal counseling, on the other hand, is practiced by counseling psychologists, marriage counselors, family counselors, social workers, and even teachers. But people who go for counseling are normal people, not abnormal people, not a diseased people. People who go for counseling are normal people who need help to cope with their personal problems. What problems? You have vocational problem, vocational counseling, marriage problems, marriage counseling, problems in the family, family counseling. We have different types of counseling. What are the requirements of a counselor? Counseling profession demands certain requirements. If you want to become a counselor, certain things are required. Certain traits are required. You need to have certain traits. What are those? The first one is well-balanced personality is required for a counselor. Well-balanced personality means emotionally stable, not short-tempered, nor emotionally cool. Those who are able to manage the stress, emotionally mature, flexible, and having harmony with other people. This trait is called as well-balanced personality. A counselor requires this. Second is superior intellectual ability and judgment, which means exceptional capabilities are required for a counselor. What are the exceptional requirements? Memory power should be good. Reasoning should be good. Learning should be good. Ability to find and solve problems. These are all the qualities required for a good counselor. The third one is curiosity to learn. Curiosity to learn means update your knowledge. Periodically, you have to update your knowledge so that your practice will be good. Fourth one is interest in persons as individual. See every client as an individual, not as a person, not as a problem. Individuals are to be treated as a person with a problem, not a problematic person. We don't use the word problematic person, we only say person with a problem. Problematic person is wrong. A person with a problem means person is good, but he has a problem. The moment you solve the problem, the person also is equally good. So you need not solve or you need not change the individual, you have to change the problem only. So person with a problem, person with a disability, person with different types of health problem, person with tuberculosis. Everywhere we use the word person with only. That is a correct terminology. Person with a problem, we call him as a client. A regard for the integrity of others, a quality of being honest, and treat everyone with respect. That is required. Next is insight into one's personality characteristics. You need to have stability. You need to be an extrovert. An introvert cannot be a successful, probably may not be very successful counselor. Talk more. A good counselor will always have a smiling approach, a pleasant approach, a sense of humor, a good mood. So we say that no personality characteristic is bad, but only thing is to become a good counselor, you need to be an extrovert. Extrovert means not too much, talk much, talk, have a pleasant talk, have a smiling approach, a sense of humor is required, but not completely alone, completely prefers isolation. That person may not be very successful. Okay, tolerance, ability to handle difficult conditions, no arrogance, and tolerate the work pressure, ability to withstand the pressure of work. You may be having teaching classes, you may be having other work. In addition to that, you will be having this work also, but tolerate the work pressure. Ability to establish warm and effective relationship with others. That's what we say rapport. You should be able to establish rapport with the client. Have a good relationship with the client, a professional one, a positive one, a purposeful relationship. Methodological work habits, be flexible. Keep some time every day. When you say 5 o'clock means it is 5 o'clock only. Methodological work habits. Acceptance of responsibility. Be optimistic and hopeful. Take extra responsibility. Don't run away from the responsibility. Accept that and do it. Integrity. When I say integrity means honesty. Self-control. You need to have willpower. No temptation, please. Stability, emotionally balanced and reliable. Next one is ethical issues. You have to follow ethical issues. Respect the cultural practices of others. Don't encroach into their culture. Whatever may be their practices, respect those practices. Ethical issues, when they say confidentiality, when they say informed consent, all are called ethical issues. Educated person, the last one is you require a qualification. What qualification you want? I say it can be a certificate program, it can be a diploma program, it can be a degree program, it can be other things. But in the list we have given that as the last one only, because that means education is not that important compared to others. There are 11 other things are there. This is the 12th one. So we need a qualification. It can be, we have so many universities offering this counseling program. You can acquire that. You can go for practicals also. Whenever you find some time, without disturbing your routine work, you can acquire the qualification also, and you can be a good counselor. Okay, next one. What are the types of counseling? Broadly, there are 3 types of counseling. I will only just give summary only. Directive counseling. Directive counseling means it is called counselor-centered approach. This is one type of counseling, one approach of counseling or one form of counseling. What is directive counseling? Directive means giving direction to the person. A person comes with a problem. He gives his problem, he presents his problem to you. He will say, I have this problem. I have this inconvenience. I have this type of problems are there. He will give his problems only. Afterwards, the counselor, it is his duty to analyze the problem, to understand the problem, and finally to provide a solution to the problem. And the client has to follow whatever solution you provide. This is called directive. I am directing you. I am telling you what you should do. The counselor directs the client to take steps to resolve his own conflicts. I will give you prescription. I will give you solution. I will tell you what you should do and do whatever I say. This is called as directive type of counseling. The focus is on the problem, not on the person. Client's dependency on the counselor is mainly observed. The client depends on the counselor only, completely, because I don't know how to manage the problem. I don't know anything. You tell me, sir, I will do whatever you say. This is called directive counseling. So in directive type of counseling, the counselor is supreme. The counselor knows things. He is the person to decide what is to be done. Client has no choice. Your duty is only to present your problem. And counselor takes the responsibility of providing solution to him. So it is based on the assumption that the client cannot solve his own problem. I'm sure that you can't solve your own problem. You are innocent. You are ignorant. You don't have competence. So I give you direction what you should do. So follow whatever I say. Do what I say is called as directive type of counseling. So in this type of counseling, the counselor talks more. The counselor talks more. He takes the direction of conversation, what to talk, what to discuss. I will decide as a counselor. The focus will be on the problem, not on the person. The emphasis is more on intellectual aspects, not on emotional aspects. It consumes less time only. Treating the problem or solving the problem will not take much time because you present your problem. I am giving you a solution. Follow whatever I say. It is best for a client, those who are immature people, innocent people, ignorant people, not knowledgeable people. This type of counseling is good. It is counselor-centered counseling. Everything centers around the counselor. I am the boss. I am the main person. I know things well. I am knowledgeable. I am an expert. I know how to solve the problem. Your duty is to present the problem only. Other things, I will take care of it. Counselor is authoritative person who gives his judgment. He talks more. He talks most of the time, he only talks. The function of the client or the counselee is to cooperate with the counselor in the whole process. Counselee or the client plays a passive role. Passive role means very mild role, will not talk much. Okay, in directive type of counseling, the client will never become independent of the counselor. So dependency on counselor is expected. Now let us see what are the directive counseling summary. I'm just giving a summary. Responsibility. Solution of the problem is counselor's responsibility. You tell me your problem, I will give you the solution. Follow whatever I say. Status. The counselor is supreme and knows what to do. I am supreme. Role. The counselee means client is psychologically dependent on counselor for choosing a solution. The counselee depends on the counselor. Whatever the counselor says, blindly the counselee follows. Karana enu, the reason is I do not know how to manage the problem. You tell me what I should do, and whatever you say, I follow it. Emphasis is on the surface symptoms. Solution of the current problem is more important. Okay, the second one is non-directive counseling, or otherwise called as client-centered approach. This is the most important type of counseling. The leading supporter, Carl Rogers, very, very popular method of counseling throughout the world. We use two terms here. One is counselor, another is client. Client means the person who is in need of help. Counselor means the person who provides help. Client plays a major role in the process. Client only plays a major role. Please understand, in the previous method, the client talks less only, the counselor dominates the whole thing. Counselor listens silently. The role of counselor is to listen whatever you say silently, while the counselee speaks freely about the problem. You tell me what is your problem. So the client talks more. There is no interruption from counselor's side. His role is more to listen to the person. More to listen to the person. The way the therapy hour is used is determined by the client only. A client only will decide what to say, how much to say. Everything is in the hands of counselee or the client. But counselor empathizes with the client. They show empathy. I understand your problem. Counselor has high regard for the capacity of the client to solve his own problem. Counselor believes that the client has the capacity. Everyone has the capacity. I'm sure that you have the capacity to analyze your own problem, understand your own problem, finding a solution to your own problem. Everything can be done by you only. I am here only to monitor your work. I am here to stimulate you. I am here to encourage you. But finally, decision will be taken by the client himself. The client is the decision maker of his own future. This is non-directive type of counseling. And the counselor attempts to think with the client rather than about the client. Okay, this is non-directive type of counseling. What is the summary of this counseling? Non-directive type of counseling summary is responsibility. Solution of the problem is the counselee's own responsibility. It is the responsibility of the client to manage his own problem. Whereas in the first one, it is the counselor's responsibility. Now it is the client's responsibility. Status, the counselee is equal to or even more important than counselor as a person having the problem. So status is elevated. The counselee enjoys equal status, sometimes more than that also. The role of the counselee or the client is psychologically independent as a person in choosing the solution. I am here to choose whatever is best for me. Method of counseling primarily, the counselee primarily controls the direction of conversation and does most of the topic. The counselee primarily controls, the client primarily controls what to talk. Next is eclectic approach. The third one is eclectic approach. Counseling is not a predetermined and prescribed activity. Clients are not fitted to one method of counseling. Please understand, we have broadly two types of counseling. One is a directive, another is non-directive type of counseling, whereas eclectic counseling is a combination of one and two. We take certain clues from different methods, amalgamate everything, and finally we prepare an approach. That approach is called as eclectic approach. In eclectic approach, the therapist uses whatever technique he or she feels are most appropriate for the given situation. Today, most therapists probably would describe themselves as eclectic. Eclectic approach is not an independent approach of counseling. We take certain things from directive counseling, we take certain things from non-directive counseling, we add certain things from our side also, we amalgamate all the three, combine and prepare an approach for a given case. And that approach is called as eclectic approach. Eclectic approach means it is a combination of different things depending upon the problem and depending upon the situation. So this is eclectic approach. We have four important tools of counseling. The tools are: one, interview. The second one is observation. Third one is listening. And the fourth one is a professional relationship. So before that, I will just give you 5 points or 4 points what you should not do in counseling. One, don't give advice to the person, especially when the client is able to make a decision on his own. When the client is able to think on his own, decide what is good for him, don't advise him because he is capable of deciding his own destination. So don't advise when the person is able to decide what is good for him. Be non-judgmental. You are not a judge to say what is good and what is not good. Don't make a comment at the person that you are right and your family members are wrong. You are there only to listen to people. Keep everything with you only and not to share with others. I have understood your problem, and in this case, I understand who is at fault and who is not at fault. But still, I keep it with me only. I don't share this information with anyone. Because I am not a judge to say that you are right and he is wrong. That's called as a non-judgmental attitude. I am here not to say who is guilty and who is innocent. I am here only to listen to you. And whatever information you give, whatever I observe, that I will make use of it in solving your problem. That's all. The third one is not to push or reject the counselor's values. Do not criticize the values, beliefs, and religious practices of others. Don't make a comment at them. Even the practices are against, are not in favor of you. Don't criticize their religious practices, values. Respect those practices. So respect the practices, values, beliefs of people. Respect them. I respect your practice. I respect your belief. So this is what is required. Respecting the practices of others. Don't make a comment at the practices of the people. And last one is no emotional attachment with the client. Don't have any emotional attachment with the client. The person has come. We have helped him. That's all. Your job is over. Not to have any other attachment with the person. No more attachment. Your relationship with the client is you are a counselor and he is the client. Nothing beyond that. Okay, now let's come to what are the tools we use in counseling. Interview is one tool. And the second one is observation. Third is listening. And fourth is professional help. Out of the four, I have explained already three: observation, listening, and professional relationship. What is interview? Interview is a conversation between two persons with a definite purpose. Interview is a conversation between two persons with a definite purpose. The purpose is known to both the parties. It is a conversation with a definite purpose. And the purpose is known to you and known to me also. It is not a simple two-way conversation between an interrogator and an informant. In police station, whatever they follow is not interview. They ask in different way a question for which the person has to answer. But counselor questioning is different. It is a systematic method by which the counselor enters more or less imaginatively into the life of a comparative stranger. Interview is not interrogation. Interview is a mutual view of each other. I understand you and you understand me. It's called mutual understanding. Interview is an interactional process. We have different types of interviews. Broadly, we say structured interview, unstructured interview on the basis of type of approach. I repeat again, we can classify interviews on the basis of type of approach: structured, unstructured interview. In structured interview, the questions are prepared well in advance, prepared in a specific order, and we ask questions one after the other without missing any question, without adding no addition of any question, no deletion of any question. That's what we say structured interview. Structured interview is otherwise called as formal interview or directive type of interview where everything is pre-planned. So there is no possibility of forgetting anything. There is no possibility of missing anything. The other one is non-directive. Unstructured interview is otherwise called as non-directive interview, which is quite flexible. We ask more of open-ended questions. In unstructured interview, more questions are open-ended. Open-ended means giving a chance to other person to think and answer. Think and answer rather than giving monotonous answer. So I may say that, how are you? How is your life? How is your family life? What do you say about the course? What are your experiences? These are all open-ended questions where the person has to think and answer. The answer is a very detailed one only. Don't ask only mechanical way of answering certain things. That is what we say yes or no type of questions. We have three types of interview on the basis of the function. One is research interview. The second is diagnostic interview. The third is therapeutic interview. In the research, we use interview. We use interview for getting the data. We prepare an interview schedule. Diagnostic interview, we conduct an interview. Finally, we arrive at the conclusion what is really bothering him. This is called as a diagnostic interview. Treatment interview or therapeutic interview, we use interview as a weapon to manage the problem of the individual through counseling, through explanation, through advice. Number of persons, on the basis of number of persons, we can classify interview into two. One is individual interview and the group interview. We can also classify interview on the basis of length of contact. It can be length of content also. It can be short interview, it can be long interview also. Content-wise, short interview means only 15 minutes interview. 10 to 15 minutes only, that's all. Long interview means generally it takes 45 minutes to conduct the interview. The initial interview will always be long-term interview only. It is a long contact interview. So short interview means the person who comes for follow-up. Usually when people come for follow-up, you don't require much time. Last month he came, this month also he came. Okay, we talk to them, we see the improvement and we assess the improvement and we think of the alternates or other things. That's all. That's what we say follow-up. The same is the case with the doctor. When you go to a doctor first time, he requires more time to examine you, to get the complaints, to do everything. Second time when you go for follow-up, it doesn't require much time. The same is the case here. Short-term interview, short content interview, long content interview. We also have other types of interview. Focused interview, depth interview, repeated interview. In industries, we have interview in the beginning stage. That's what we say selection process. Selection, we use interview. And the last stage of employment, that's called as exit interview also. At the time of leaving the organization, we conduct the interview. That's called as exit interview. Why interview is required? So we require information about the client, about his problem, about his background. That's what we say informational interview. Information interview means to obtain interview. That's what we say social study. We use interview as a tool in getting the information from different sources. We interview the client, we interview the family members, we interview other persons. We get as much information as possible about the person, about the problem, about the background. We use a diagnostic interview to arrive at an appraisal. And last one is to bring a change, we use a therapeutic interview also. So we have different types of interviews. But how to conduct an interview? Interview takes place between two human beings. Hence, there are no rules and regulations to conduct an interview. Interview is an interactional process. It is a mutual view of each other. So when you conduct an interview, select a place where interview can be done. In all colleges, we say that there should be a separate room for counseling, a counseling room, where you conduct the interview. The place of interview, the time of interview should be specified well in advance. Generally, the interview starts with the greetings. You explain the purpose of interview. The purpose of interview is to know more about you, more about the problem, more about the situation. I want to know about you, about the problem, about the situation so that I can help you. After greetings, respect the person, maintain the timings. Avoid writing in front of the client. Don't write anything in front of the client as far as possible. After the interview is over, then keep writing. If at all you want to write, take the permission of the client and then write. When you write, what happens, the person will be much worried, maybe afraid that you are noting down something which may spoil his future also. Maintain optimum distance. Privacy is maintained. Confidentiality is maintained. Encourage the person to talk more. Opening conversation is more important how to start. So this is what we do in interview. So interview is conducted in a place free from all disturbances. And we also, next, observation. I have already explained to you observation. I already explained to you listening. Last I said about worker counselor client relationship as a tool in counseling. Relationship is important for growth. We have different types of relationships. Some relationships are temporary. Some relationships have a purpose. Some relationships are bound by time. So we have different types of relationships. Every case is a time-bound affair and it has to be terminated sometime or the other. You can't drag on the case for a long time. A strong relationship is important in counseling. These are all about okay, next one is how to conduct a counseling session. Just 1 minute, the slide is not moving. Amma, slide move ಆಗ್ತಾ ಇಲ್ಲಮ್ಮ. ಎಲ್ಲ ಇದೇ ಪ್ರಾಬ್ಲಮ್. ಅವ್ರನ್ನ ಓಕೆ ನನ್ನ ಫೋನ್ ನಿಮಗೆ ನೋಡಿ
ನಾನು ಕೇಳಿಸುತ್ತೆ ನೀವು ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಸರ್
ಇದೇನಿದೆ ಪರವಾಗಿಲ್ವಾ ಓಕೆ ಕೂತ್ಕೊಮ್ಮ how to conduct a counseling session place of counseling session I will give you a summary because we are running time place of counseling session there should be a specific room allotted for counseling it should be free from all disturbances sufficient furniture should be available in the room and the place should be free from all disturbances and maintain privacy and avoid conducting counseling during odd hours. When I say odd hours means after the college is over, after the working hours, don't conduct counseling. Role and behavior expected of a counselor and guidelines for effective interview. Plan your interview. Conduct the session according to the convenience of the person. Maintain the timings. Greet the client. Have a small talk. Offer him a seat. Be polite. Show respect. Sit very near to the client. Maintain optimum physical distance. Introduce yourself properly. Plan the time properly. Look at the person while talking. Encourage the person to talk more. Please understand that no person will tell all his problems to you in the first occasion. He may be afraid of you. So he may give only some information only. Second visit, he may be more comfortable if your approach is good. Don't exhibit the signs of exhaustion. Don't say that you are tired. Don't look this side and that side. Don't give false promises to the person. Observe his feelings, emotions. Respect the personality of the individual. Call him by name. If he's a student, call him by name. Don't dominate in conversation. Don't be argumentative. Don't quarrel with him. Avoid long silence. Encourage the client to talk more and be open. Give ample time to respond. Don't accept gifts. Follow dress code if you have any. Don't call the person over phone, especially in odd hours. Don't make a note of the proceedings in front of the client. Don't write anything in front of the client. But there should not be any difficulty in starting a conversation. Don't interrupt when the person is talking. Don't deny. Don't say that you are wrong. Don't contradict when the person is talking. When the conversation turns into some intimate subject, something you are touching, very delicate subject, when the client starts weeping, allow him to weep. But if the weeping is too much, then you change your topic. So if the person expresses his emotions, allow him to do so. He is angry, let him shout. He is upset, let him weep, but that should not be too much. If it is too much, what to do? Change the topic and then come back to this topic afterwards. Don't leave the topic. You are only temporarily changing the topic and again you are coming back afterwards. There should be natural closure in the interview. Natural closure. It should not be closed or stopped abruptly. The next one is questions to ask. Questions to ask, questions to avoid, effective listening, and last one is observation. Oh, madam. Questions to ask. Ask simple questions to the point, nicely worded, good language. Ask only one question at a time. Avoid combining so many aspects in one question. Questions must be timely, wisely framed questions. Don't ask questions that are difficult to answer, very difficult to recall the past also. And don't test the memory power of the client. There should be coherence and orderliness in your questions. Talk less and listen more. Avoid closed-ended questions as far as possible. Make open-ended questions are desirable. Okay. These are type of questions. Questions to avoid. There are certain questions to avoid. Questions, lengthy questions. A question is very lengthy, 3-4 lines. Avoid that. Leading question. Leading question means in the question itself you have the answer. You want that answer to be there. That's called leading question. Leading question means giving prompting to the person to say certain things. Double questions, asking 2 questions at a time. Closed-ended questions. Avoid that. Yes or no type of questions, avoid. Teasing type of questions. Bullying or frightening type of questions. Tricky questions. Too personal questions. Too much personal questions. Presuming type of questions. And blunt questions are to be avoided as far as possible. Oh, madam. Madam. Blunt questions are to be avoided. Next is effective listening. Effective listening. Next one.
ಮೆಸೇಜ್ ಬರ್ತಿದೆಯಲ್ಲ ಅದಕ್ಕೆ ಸರ್ ಬರ್ತಿದೆ ಸರ್.
Okay, effective listening. Talk less, listen more. Listen to understand rather than to reply. Avoid signs of distraction. Do not interrupt when the person is talking. Hold your temper. Listen with concern. Look at the person and talk. That's the thing. Observation. Observation is a skill. We can observe the client from different points of view. Explained to you earlier, physically, emotionally, interpersonally. Okay, next is the process of interview. Process of interview. There are 3 steps in the interview. One is rapport building, second is exploration, and third one is action planning. Stage 1, establishing rapport with him, good relationship with the client, which includes offering a seat, a small talk, conversation of personal matters, eye contact, respond both verbally and non-verbally, encourage the person to talk more. Second is exploration, going into the depth of the issues, get more and more information about the problem, about the person, about the situation. And third one is action plan. Plan what is to be done.
Dear
Plan the
participants,
solution. Hilbika?
to visible the PPT.
No,
No, ma'am.
not visible.
No.
Dear
No, ma'am.
participants, hello. Anyone reply,
Is it
please?
visible?
It's not.
No, sir.
No, sir. No, sir. No, madam.
Okay.
Niche ಆಗಿಲ್ವಮ್ಮ?
ಆಗಿತ್ತು sir.
Okay, previous slide. What about the previous slide?
No, it's not.
Yes,
What
sir,
about
it
this
was visible.
Previous slide shows, sir.
How to conduct the counseling session was done.
How to conduct a please understand.
Okay.
The last slide which was visible was previous one.
After that also,
Now, madam,
This one, previous slide, no.
process
Previous
of
one, yeah.
interview is not visible.
Last slide was how to conduct.
What about this one?
Conduct counseling.
Not
yes,
disclosed.
visible.
Okay.
How to
Next
conduct
one.
counseling.
This was
Now
last
it
slide.
Next slide.
it is visible, ma'am.
Okay, next
now
slide,
visible.
please. Okay.
Now it is visible.
Yes,
Now
please.
visible.
Counts-
Yes, sir.
Yes, sir. Okay, please. Counseling is a process. It involves different steps. When we say process means a progressive transaction, a process, progressive steps to achieve the goal. Mainly, there are three steps. Step 1, step 2, and step 3. And the last step is solving the problem of the person. The first one is rapport building, establishing relationship with the client. The second one is exploration. Exploration means getting more and more information about the problem by asking questions, by asking open-ended questions. And finally, explore, problem identification and diagnosis will be there in exploration. Action plan means what is to be done, how to manage the problem, what is the alternate solution. Everything has to be planned. This is the process of counseling. Mainly 3 steps are there. The first step is rapport building. The second one is exploration, means getting more and more information about the problem, about the person, about the situation. The third one is action planning, means planning the solution to the problem. Planning the solution. Think of alternate solution also. And finally, everything will be in discussion with the client. And finally, the client will decide what is good for him. Then afterwards, follow up the case and then terminate the case. Okay, there are certain unethical practices in counseling. These unethical practices should be avoided. One is client dumping. Client dumping means you have taken a person for counseling. Initially, you have taken and you have given help to him. But in the middle, you close the case and say that everything is over, you go. Telling the client that goals have been achieved. Everything is over, now you can go. That is called as client dumping. Dumping means leaving in the middle for various reasons. I have taken you as your client and I am helping you. In the middle, suddenly I say that everything is over and everything is over, you are all right, you get out. Leaving the person in the middle is called as client dumping. You may say so many things. Problem is solved, you go. Or problem is very difficult to solve, you go to another person for help. I will give you another person, go and receive help there. This is what we say client dumping. Dumping means leaving in the middle is unethical on the part of the counselor. Second is a dual relationship. Dual relationship means having 2 relationships with the client. One is a client. The second is something else in the society. You have other relationship. I said earlier that you are a client here, but outside you are a partner in my business. So you cannot have 2 relations. This is unethical practice, and in other countries it is illegal also, and action can be taken against the counselor also. The third one is involuntary client. Involuntary client means the client who is not willing to come for counseling. The client is not motivated much. People have asked him, the principal has asked him, you go and meet him. So he comes to you. He comes to you, but without any interest. That's what we say, involuntary client. Sir, I have come to you because he asked me to go. I have come. I am not really motivated. I am not really interested. I am still stubborn only. And whatever you say, that will not go into the mind. That's what we say, involuntary client. He cannot be changed because he is not motivated. What is required is motivation. Would you like to be free from the problem? If you say yes means come to me, I'm here to help you. If you don't want to leave the problem and there is no use in coming to me repeatedly, that will not help you. That's what we say, involuntary client. Violation of confidentiality. I have promised that I will not reveal this information to anyone. I have given you the promise, but now I have revealed. I have revealed your name, your photo, your other things in the newspaper also. I have written an article sending your photographs also. This is what we say, violation of confidentiality. This is what we say, breach of trust. Breach of trust means I have believed you completely, but you have really acted differently. I trusted you. This is my trust. Violation of confidentiality means you have violated the promise that you have made. You have made a promise. Now you have violated the promise. That's what we say, violation of confidentiality. We have one more type problem is called as fight into illness. There are certain clients who are really having attachment with the counselor, very, very remote cases. The counselor says that everything is over and okay, we'll terminate the case, henceforth you need not come to me, over. But just before the termination, he will develop a new problem so that he wants to have a continuation of the relationship. This is unethical on the part of the client. So client doesn't want to leave the counselor. Having some emotional attachment, this is also unethical on the part of the client. Okay, these are all unethical practices. But we also have limitations of counseling. We cannot practice counseling with cases of psychopathic personality. Psychopathic personality means a person is having antisocial personality, where the personality itself is deviant, disturbed. For example, the person is very intelligent person. Those people always in conflict with the law only. Whatever advice you give, whatever counseling you give, that will be of no use. Sometimes he is more intelligent than you also. When you ask some questions, he will ask two questions also. He knows how to manipulate things. His intelligence is used for that purpose only. He is very clever and there is no sense of shame, no sense of guilt. Whatever mistake that he has committed also, no tears will come from his eyes also, no repentance for whatever he has done. He has impulsive behavior. He will not wait for things. He wants everything to be done immediately only. Lack of responsibility, irresponsible people. They are frequently in trouble with the law. And most of the time, they will be busy with police cases only. But they have the outstanding ability to rationalize their difficulties. And they always blame others for their problems. They know how to manipulate. They are pathological liars. When they say pathological liar means lying for no reason. He is not telling the truth. He is telling lies only for no reason. For no reason. It is not necessary, but still he tells lies only. So this type of persons cannot be treated with the counseling. Counseling will not be of much use to these kind of people. You may try your best, but little can be done. Little success can be done, but complete success may not be possible because his personality itself is deviant, disturbed, pathological in nature. That cannot be corrected. Next, dealing with intellectually disabled persons, persons having less IQ. Can you help them? Means you cannot help them. Whatever you say, they don't understand whatever you say. Their IQ is less. Their IQ is less than normal. They don't comprehend. And whatever you say, it will not go into their mind. So these people cannot be reached easily with your counseling sessions. But family members can be given counseling, not these people. The third one is those who are suffering with psychosis, severe mental disorders that cause abnormal thinking and perception. Counseling is less effective, but with family members, counseling will be very effective. So these are all the drawbacks of counseling. And the last one is unethical practices and limitations of counseling. Probably that is the end of the topic. Thank you very much. And we come to the close, and you can ask me questions. We have 10 minutes time exactly.
Sir,
Yes, ma'am.
can I get the difference between the mentoring and the counseling? Is it same or still there is a
Same. See, what is your question is over?
difference between mentoring and counseling?
Okay, we use the term mentoring in industries. He is a mentor. Who is the mentor means generally all senior people opt the mentorship. We ask people, would you like to be a mentor? We identify people, those who are good employees, those who are very honest, those who are very responsible, and those people are identified as mentors. The new entries, the young person, those who have come, every person is given to a mentor. You follow him. You share your problems with him. So this is what we say mentoring. So you are following him. He's a model. He's a role model.
Okay.
From him you can understand the work, how to move with the people, how to do the work, how to correct those things. Everything you can learn from him. This process is called as mentoring. Okay, this is based on a story by name of mentor. This is the name of a person who molded the other person on the basis of this story only. The mentoring has come. So mentoring and counseling are almost same only with the different designations and with the different contests. In family counseling center, you say counselor. In the industry, you say mentor. Somewhere you say helper. Somewhere you say healer. You have different designations, but the work remains same.
Okay.
Next question, sir.
Sir, one more.
Right, ma'am.
Like in medical.
May I know your name, please?
I am Sana Kolar, sir, assistant professor in zoology from Anjuman Degree College, Vijaypur.
Anjuman Degree College?
Vijaypura, Karnataka.
Vijaypura. Okay. Tell me.
Sir, in medical diagnosis, after the studying and everything, there is a termination. You said the last step is the termination after the line of the treatment. Same in the counseling procedure. What is the status of termination? Means we will end the case, or how one has to terminate the case?
Okay, ma. There are two ways of terminating a case. One, you have really helped him. It is very successful. The person is free from the problem. He is well adjusted with his family and with other social circle, and with a healthy